Okay, I'm going to go over the four hypothetical research scenarios related to my professional interest in kinesiology. So the first one is complete participant. In this scenario, I will study how soldiers informally support each other during physical training sessions. As a military officer and fitness leader, I already participate in this kind of unit training. In this hypothetical study, I would fully participate in morning physical readiness training while observing how soldiers encourage each other, respond to fatigue, and maintain motivation during high stress workouts. The advantage of this method would be allowing me to capture authentic behaviors because the participants act naturally when they do not know they're being studied, and it would also provide deep insight into team cohesion, peer accountability, and informal leadership during the training. So, participant as an observer, in this scenario, I would conduct research on the impact of yoga integration with football, strength, and conditioning. These are all hypotheticals, like I said before. I would join the team again um, as both a researcher and active participant in the yoga sessions while only informing athletes and coaches that I'm just studying how yoga affects flexibility, injury prevention, these kind of things. The benefit of this approach is so I can build trust and rapport with the athletes while still gathering my experimental data. And by participating in these sessions, I can better understand athlete perspectives and physical challenges. Observer as a participant. So in this scenario, I would observe cardiac rehabilitation and participating patients in an intensive lifestyle intervention program, such as structured rehabilitation or wellness training model. My primary role would be to observe patient interactions, adherence patterns, and motivational behavior during exercise sessions. This method would allow for more objective data collection while still enabling a clarification of each participant's perspectives. It also would reduce the likelihood that my presence would change group dynamics significantly. However, this approach might limit my ability to fully understand participants' experience because I'm not fully immersed in the rehabilitation program myself. The next one is complete observer. So in this scenario, I would analyze recorded video footage of group exercise sessions in a rehabilitation or athletic training facility. I would observe movement patterns, communication styles between coaches and participants, and adherence to exercise protocols without interacting with participants in any way because I'm just looking at recorded video. The strength of this method minimizes research influence. It would also allow for repeat reviews of behavior for accuracy. It would also reduce ethical concerns related to direct interaction if proper consent for recording has already been obtained. However, this approach would lack some of the contextual understanding and emotional insights of the participant's experience and could make it a little bit more difficult to interpret motivations or internal responses to training. In conclusion, each observer involvement method offers valuable insight and presents unique challenges with each ethical and methodological challenges. Of course, selecting the appropriate amount of involvement depends on the research question, the participants' population, and ethical concerns. So this is kind of a broad stroke to paint many different possible research studies. But in kinesiology and rehabilitation research, combining these approaches, using one or combining them can provide a comprehensive understanding of both behavior and participant experiences. Thanks.